back to Two Doulas in the Pod, the podcast where we discuss all things birth, advocacy, and everything in between.
I'm your host, Arlicia.
And I am Fatihma.
And we're your two doula bays. Welcome back to the couch.
Welcome back.
Welcome back.
So let's get into it. Today we'll be discussing inductions, interventions, C-sections, and everything that may not be necessary or may be necessary during the laboring process.
So this episode, we're just going to dive into what the landscape of common birth interventions look like. Specifically, like Fatihma mentioned, cesarean sections, inductions, and other medical procedures. We're just going to touch on these things that are medically necessary in some cases. Sometimes they may not be as necessary depending on your condition, when these things might be overused, and how birthing individuals can feel empowered to make informed choices when these options are presented to them.
Perfectly said. So let's get into understanding interventions. What exactly is an intervention? So an intervention is anything outside or that may disrupt or changes that are made that are not a part of the natural process of labor. So that could include a cesarean, of course, epidural, membrane sweep, cervical checks, fetal monitoring.
Episiotomy.
Yes.
You have episiotomy.
Yes.
Induction of labor, when you're giving medications to start the softening or the ripening of the cervix so that you dilate.
Yes, and even your home remedies like your midwife's brew or just anything that is not a part of your spontaneous, laboring, anything that will change the trajectory of your labor.
So anything augmenting or changing the physiologic process of labor, the natural physiologic process of labor.
Yes. And let's talk about when interventions or inductions are useful. Because it's not a bad thing to be induced, especially medically induced. But let's talk about when you should have an induction or when you should have an intervention. So cesareans can save lives sometimes. And this could be when you have fetal distress or placenta previa or cord prolapse. So these are some serious, situations where you want to consider, having a cesarean, or your provider may recommend, and they should be explaining why they're recommending this procedure, because a cesarean is a major operation. It's a major abdominal surgery.
Absolutely. It's invasive, right?
Yes.
But it's also, in those instances that you just named, this is life-saving for mom and for baby. For example, placenta previa, that's a condition where your placenta, which of course gives the blood supply and feeds your baby throughout your pregnancy, your placenta attaches too low at a point in your uterus, and it covers part or maybe all of your cervix, the opening where the baby is supposed to come through the birth canal. So that is considered, an emergency situation, and we don't want the baby to be blocked from coming through the birth canal. So the safest way to get baby out is via C-section.
Yes. And sometimes some people have never even heard of that until they're faced with that situation.
Absolutely.
And then it can send you into a panic, and you may not know your options, or you may not understand why you're experiencing this or what exactly this condition is.
Right.
So it's very helpful for you to inform yourself about different scenarios, or not scenarios, but conditions that may cause you to have a cesarean.
And ask questions. If your provider is throwing out these terms and you really don't know, I would always say, a Google search will do you, some justice. However, allow the provider to explain the condition to you in a way that, is easy to understand without all the medical jargon. And I know for myself, just from experience of being hospitalized, when the provider finds out I'm a nurse, then their tone changes. No, I want you to talk to me like a layperson.
Yeah.
And I feel like everybody deserves that, to be talked to, in a way where the information is understood and nothing's going over your head. So, make it a point. If you really don't know and you want more understanding, just ask your provider, and I'm pretty sure they'll be more than willing to.
Yeah, and if they're not willing to explain recommendations or conditions or procedures, that is a major red flag.
Red flag, y'all, red flag.
Red flag. So, inductions may include, a reason for induction could also include preeclampsia, post dates, meaning that you are past your due date, which could be 42 weeks plus.
Okay.
So that would be considered, a situation where you might want to consider an induction, simply for your safety and the baby's safety. And fetal growth issues, meaning baby is too small for the gestational age or too big for the gestational age. And that is a topic where not too small but too big. Sometimes as a doula, I'm on the fence because a lot of women will be told that your baby is too big or is projecting too big.
Right, or your pelvis is too small.
Yeah, your pelvis is too small. And I find it that sometimes that's not true. And sometimes your baby is exactly big enough for you to deliver them. It's your baby. Your body made the baby.
Right.
And sometimes you may want to get a second opinion or just have your provider explain at what point, is this not mandatory, but should I seriously consider, and not necessarily a projection or because you're projecting or you're guessing, but is it actually accurate? You're not 7 months with an 8-pound baby in your belly. That's pretty big. And the fact that it would grow bigger, okay, that's different. But that's not really likely. I've never heard of a situation like that.
You know what else though? Besides the size or too large for dates, or maybe there is the intrauterine growth restriction where you're too small. You mentioned preeclampsia,
yes,
which affects us in our community as Black women, affects us more disproportionately compared to our counterparts in other ethnic. So what is preeclampsia?
So preeclampsia can be defined as high blood pressure during pregnancy and protein in the urine. Some symptoms may look like headaches, of course, high blood pressure, your provider checking and seeing the protein levels, which would be there, vision blurriness, swelling of the hands and feet or face.
That's a major sign.
I've even seen, moms online or even in person experience lots of vomiting.
Oh, wow. Okay.
Yes. So that was my first impression of preeclampsia, seeing the vomiting, the swelling of the feet. But it can be defined as high blood pressure and protein in the urine.
Was that with a recent client or just?
It's actually with an online mom. She documented a lot of her pregnancy. Her name is Carrie. Her daughter is, I can't remember her Instagram, but she does document a lot of her pregnancy. She just had her fifth girl.
Oh, wow.
I have to find her name, but yeah. So she, that was my first impression, even before I became a doula, of preeclampsia. I had no idea what it was. So as we learn, we see that it's, can be a rough condition to deal with, especially while pregnant, as if pregnancy is not.
Right.
It's already can be a little rough.
But also, you can have that postpartum, too.
Yes.
After delivery.
Yes.
So, you go home, you're with the baby, and things can take a turn.
Yeah.
If you're not careful, you can still have the feet swelling, because remember, the body is now readjusting to being pre-pregnant.
Yeah. And your hormones are still
hormones,
adjusting, still high. So,
there's a fluid shift that happens. You just lost a lot of body fluid, right?
Yes.
You pushed out a baby, or you had a C-section, right? So the
And
body,
you're still losing
yes,
bodily fluid, blood.
body is adjusting back to its normal state. So, you know, these are things that we encourage you to look out for during pregnancy, during labor and delivery, and of course, postpartum.
Yeah. However, you can still deliver your baby naturally and vaginally if you have preeclampsia. And what we want you to do is just inform yourself of what preeclampsia is, so that if your provider just says, oh, you have preeclampsia, we need to give you a C-section, and you don't just say, well, okay, you get informed, ask questions, ask why exactly do I need to have a scheduled C-section or a scheduled induction, and that's not what I want. So if you're informed about the condition, if you're informed about when, you know, these inductions or this, you know, a cesarean should be performed, then it'll give better results into you getting what you want.
Absolutely.
You know, and
Absolutely.
it will reduce the harm that is caused when inductions are overused during pregnancy. So let's talk about, you know, the overuse of inductions during pregnancy, because it's a big thing, it's a big problem, and it's very common.
Okay.
Yeah. So let's talk about some stats.
Where shall we start?
So, hospital routine or hospital policy versus individualized care.
Okay.
You know, is this the hospital's policy to induce you or perform a cesarean? And what is your, you know, your plan, your game plan? What kind of care do you actually need versus just going along with the hospital policy?
Or, you know, if they're a private provider and they just happen to have community privileges at a hospital, right? That office has certain protocols in place when treating their pregnant patients.
Yeah.
So these are things you need to, you know, kind of talk through and figure out ahead of time. And in this day and age, I mean, we have Google, but it's best to go to your provider and really ask them the questions so that you are informed and empowered enough to make the best decision
Yeah.
as far as your care is concerned.
Yeah. And high induction rates, high C-section rates, they all can be boiled down to convenience, liability, policy, and it's not always medically needed. Sometimes, and I say this to my clients, in the hospital, it's very transactional. You have to think of a hospital like, of course, they provide care, but this is a business. And they have these policies in place to maximize the amount of profit that they get. So you, just a person that they don't know, having a C-section is most times, if not always, more money for them.
Absolutely, yeah. The reimbursement rate for a C-section is a bit higher than the reimbursement rate from the insurance company for vaginal delivery.
Yes.
I've seen that firsthand.
So
I've seen the numbers.
This is big business, and you need to be aware of that, because of course your provider is providing care for you, but it is certainly not personal, it is business. You know, you have to think of them as practicing, because that's exactly what they're doing. So you being aware and informed is crucial, because you don't want someone to be practicing on you, or, you know, eager to get you along, eager to induce you because they have 5 other moms on the floor and they just want to get you out of the way. But this could jeopardize your life. This could turn a wonderful experience into a horrible experience.
Hey, but did you know that Florida C-section rate stood at 36.2% in 2023, and that's about as high, if not higher, than the national average here in the United States.
Florida is just, oof,
Y'all,
very ghetto.
that's kind of a big deal.
Very telling.
Kind of a big deal.
Very telling.
Like, what are we gonna do about this number? What are we gonna do to get it down? What's our solutions?
We need more doulas.
We need
more.
We need more evidence-based, you know, research
Yes.
out there to help kind of shift the culture and the practice, moving forward when caring for pregnant women.
And we need providers to educate themselves or re-educate themselves because they've been taught one way to provide care, one scope of care, when that clearly isn't working for a lot of people.
Right.
So these are some things that to consider, if you're having hospital birth, even with your midwife, because sometimes, when you could have a midwife and hire and go to a birth center, and then something happens and then your pregnancy becomes high risk. So what's your backup plan if you have to be transferred to the hospital?
Right. Make sure you have that birth plan in place.
Yes.
But as Fatihma stated, you could be having the perfect pregnancy, and then right at the end, things take a turn. Things shift.
Post-term, you hit that 42 week
weeks.
mark.
Oh, yeah.
At that point, your midwife can no longer deliver your baby. So what is the backup plan? What type of at home, I guess remedies or what can you management? What can you do at home to help you induce at a safe time? Because, like I said, as a doula, as midwives, we have our own methods of induction also, and these are natural remedies like dates or softening up the cervix or red raspberry tea leaf. I think I mentioned before, like the midwife's brew, but even that's something that should be used post due date, because that is an intervention, that is an induction. It's a natural induction, but it is an induction, and some midwives recommend it and some midwives don't.
Right.
It just depends on their scope of practice. It depends on their own personal opinions about it.
And what they feel comfortable with, even doing and managing your pregnancy, because everybody's body is different, right?
Yes. So consider all these things during your birthing process, and try to educate yourself early so that you don't feel panic or pressure or fearful because things are not going as planned. Because like we always say, birth is unpredictable, so you need to be prepared.
Absolutely.
Yeah.
Informed consent, right? You're giving your permission to have these things done to you. You don't allow somebody to perform an intervention without your agreeing to it, right?
Yep.
So always, informed consent is huge. Make sure you read the fine print. You ask all the questions before you even sign below the fine print, okay? Make sure you got your birth plan. We touched on that earlier. Also, get you a doula. Advocacy is huge in this space, right? And you need that extra support to feel safe and empowered when making these decisions. So.
Yes. And those are some wonderful ways on how to stay informed and empowered. You also want to ask your provider what their C-section rate is, what their induction approach is, or how do they approach induction. Know your rights. Like Arlicia said, you can decline or delay any intervention. Ask the risks, the benefits, the alternatives. That's a really important one.
Oh, yes.
Ask for alternatives, because that particular recommendation may not necessarily be good for you.
Right.
Birth plan equals communication. That's we can't even express it enough. Like, have your birth plan.
Yeah, and birth plans are fluid, right?
Yes.
Hey, my birth is going to be vaginal, but in the event things take a turn and I have to have a cesarean.
Yes. This is what I want.
This is what I really want.
It's not a cesarean and then you're just left up to their care and whatever they want. You have rights every step of the way. So if you want a particular way, they're going to do the cesarean. There's no change in that procedure. But if you still want the skin to skin, the golden hour, you can have that.
Yep.
You just need to communicate.
Absolutely.
So to wrap things up, we just want you to hold space for yourself. We want you to hold space for unpredictability during birth. We want you to educate yourself. We want you to get a doula.
Yes.
If you can, get you a doula, because we will coach you step by step through this entire process, and we will educate you on all these things.
Yes.
So, yeah.
Get you a doula today.
Get a doula, we're available. So, I think that's a wrap.
That is a wrap. We'll drop some resources down below in the description so that you can go and research for yourself some evidence-based information about cesareans and inductions and post-due dates. I'll drop that one in there too. I was reading it last night. So very interesting information, but the information is here. We'd love to hear from you.
Yes,
Please
always.
comment, like, share, and subscribe to our YouTube. Follow us on Spotify, and of course on Instagram. We're at 2TWO Doulas in a Pod.
Every platform.
Every platform. Well, that's a wrap, y'all.
That's a wrap. See
See
you
ya.
next time.